The heart and circulatory system of an embryo begin to form soon after conception. As the lungs develop, the mother supplies the embryo with oxygen-rich blood through the umbilical cord. By the end of the 5th week, the prenatal heart is pumping blood throughout the embryo. Because the fetal lungs will not be used until after birth, blood must bypass the lungs to circulate to the rest of the body. Inside the prenatal heart, 4 chambers and 4 valves have formed to circulate the blood. 2 structures allow the blood to be routed around the lungs: the foramen ovale and the ductus arteriosus. The foramen ovale is a hole between the left and right atria. The ductus arteriosus is a blood vessel connecting the aorta and the trunk of the pulmonary artery. In normal prenatal circulation, the right atrium receives both oxygen-rich and oxygen-poor blood. Oxygen-rich blood arrives from the mother through the inferior vena cava. Oxygen-poor blood arrives from the body of the fetus through the superior vena cava. The blood mixes in the right atrium. Some of the mixed blood in the right atrium pushes through the foramen ovale into the left atrium. From there, it moves into the left ventricle, which pumps it into the aorta. The aorta delivers the blood to the rest of the fetus. The rest of the blood in the right atrium enters the right ventricle, which pumps it into the pulmonary artery, leading to the lungs. But since the lungs are not yet functioning, the blood moves through the ductus arteriosus and into the aorta. The aorta delivers the blood to the fetus. After birth, the foramen ovale and ductus arteriosus close as the baby begins to breathe. Oxygen-poor blood in the right side of the heart is pumped through the pulmonary artery to the lungs. Oxygen-rich blood travels to the left side of the heart and is pumped through the aorta to the rest of the body.